Okay, so you're working in the emergency room one night when some frantic parents bring in their baby, and he does not look good. He's brought back immediately, and he's kind of dusky colored, and he's floppy and not really responding. So the first thing you immediately do is put him on 100% oxygen by bag valve mask and assist his breathing, while the nurses try to put in an IV, but he has no veins. So you quickly throw in an intraosseous line and start a bolus at 10 cc's per kg. Per kg? But wait, what does he weigh? Who knows? You can't put him on a scale right now. So you lay down the Broslow tape next to the child, and you see that he falls somewhere into the purple section, so about 10 kgs. So you bolus the kid 100 cc's of normal saline. At about that time, the nurse gets an AccuCheck on the patient, and you get the sugar back. And it reads 25 milligrams per deciliter. The kid is hypoglycemic. He needs sugar, so you order up some D10, and you give 2 cc's per kg. And you make a note to yourself to remember to check that sugar again to make sure that was enough. That same nurse happened to draw a bunch of blood and just went and ordered the sick neonate order set, which included a whole bunch of stuff, a whole battery of tests, and that included a CBC, CMP with calcium in it and LFTs, magnesium, total Billy, direct Billy, UA, urine culture, blood culture, coags, chest x-ray, KUB, and to hold some extra tubes of blood, especially a red top and a green top, just in case. And you also order some antibiotics, some ampicillin, cefotaxime, and you throw in some Vanc for good measure. But as you're ordering that, you're thinking, whoa, 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 hold on a second. Can I do this without doing an LP? Can I give antibiotics? And you realize, you know what, this kid is really too unstable at this point to do the LP right now, and getting the antibiotics in quickly is more important. So you go ahead and do it. At this point, you look up at the monitor and you look at his heart rate, and it's 190. And so you're thinking to yourself, could this be SVT? And then you remember that's usually going to be greater than 220 beats per minute, so probably not. When he first came in, his SAT was listed as 82%, but now that he's been on 100% oxygen, you check again, and now it's gone up to 94%. So you take a deep breath, relieved that this might not have been some sort of ductal dependent lesion. In which case, with oxygen, the SAT wouldn't have come up, it would have stayed less than 85%. Then you ask yourself, is this CHF? But the parents don't really give any history of any feeding intolerance. And you listen to the lungs, and there's really no fluid in there. And the x-ray, when it eventually comes back, doesn't show any fluid. So you say, nah, it's not. I'm going to hold on the Lasix for right now. Then you ask yourself, could this be trauma or abuse? So you take a quick peek in the eyes, and you don't see any retinal hemorrhages, and you don't see any bruising or anything else on the body. But you know that there could be very few external signs. So you're going to make sure to get a clearer history of what happened. But right now, you're not thinking that. So is this kid jaundiced? It doesn't really look like it. And you finally get your bilirubin back, and it is less than 20. So you feel like you don't have to do any exchange transfusions or phototherapy. Next, you smell the kid. Does he smell funny, or has he been vomiting? And you ask family if there have been any similar deaths in the family, and they say no, and he doesn't smell weird. And so you're thinking about inborn errors of metabolism, and you're going to wait for that ammonia level that you sent to come back, as well as check the ABG and the anion gap. But right now, you're good for that. Could this be congenital adrenal hyperplasia? You know, the boys, they tend to not look as obvious as the girls do. The girls, they usually catch them before they leave the hospital because they have virilization of their genitalia. But the guys, they can leave unnoticed. So the kid did have a low glucose, which speaks towards it, and you check the potassium and the sodium. But the electrolytes are normal, so you don't think it's that. Next thing you worry about is volvulus. Could this be malrotation with midgut volvulus? But the kid's not had any bilious emesis. You've been asking, and he's been having normal poops. And you got the X-ray, and that looked okay too. So it's on your differential, but you're gonna hold off calling the surgeons for now. At this point, the repeat sugar comes back, and it went from 25 to 32. It's above 30, but you still feel it's low, so you go ahead and give another 20 cc's of the D10. So let's pause for a moment now. Take a deep breath. That was pretty stressful, and a lot of stuff happened right here. But this is a pretty stressful case. This is a crashing neonate. So in the next several videos, in the next several lessons, let's take each one of these things one at a time and go through them and figure out what we got to do in this otherwise stressful situation. Okay, let's begin.